Hello, friends. Today I'm going to discuss a very important topic of teenager girls, or you can say adolescent girls. Many a times, adolescent girls or their mothers are very much worried about their periods. Before starting, let me tell you, I am Dr. Sharjil. I am a gynecologist. I am dealing with gynae problems of girls, married female, unmarried female, adult women. So now I thought to discuss some problems which are very common in females and to give some information to my viewers. If you like my channel, then please like, share and subscribe my channel. So now let's begin. So now today we'll discuss about teenager girls' menstrual problems. So what menstrual problems they may face? Many a times a woman come to me and they are very much worried about their 14 years old or 15 years old or 13 years old girl child's menstrual problem. Many a times they are very much worried, and what I understood that girls, they usually don't know what is happening because they are facing their periods from last few months, so they are not aware of this, what problem they are facing, but their mothers are very much worried. That's why I thought to discuss this topic today, what actually is the menstrual problem of girls, especially between 12 to 16, 17, like this age group, or rather 18. So friends, what can be the problems in menstruation of teenager girl? Their periods may be heavy, their periods may be irregular, or sometimes scanty periods. So what is actually this? Let me tell you first and foremost important thing, that if the period is very heavy, if it's very heavy, then definitely you should reach to a gynecologist for immediate treatment. But if period is heavy but it's not too heavy so that it will disturb your health, then I'll tell you, don't worry so much, or you can consult a gynecologist for your self-satisfaction, and she may prescribe you some normal symptomatic medicines. She may not start you on some hormonal treatment because this is started in advanced cases. So if period is heavy, don't worry so much, because after few years it may regularize. You know what is the reason if periods are heavy? Because as girl grows and she reaches to puberty age or teenage, like 11, 12 years or 13 years, then her hypothalamus, that is in brain, pituitary, that is again in brain, and ovary. So hypothalamo-pituitary ovarian axis is not mature enough to secrete proper hormones. That's why there are irregularities in the periods of teenager girl. So there are hormonal imbalance. Mainly involved hormones are estrogen and progesterone, which are controlled through this hypothalamo pituitary ovarian axis. So once the the girl grows older, this axis becomes mature. Then it starts secreting hormones properly. So this is not the topic to understand you. For a layman, it's difficult to understand these hormonal imbalances, but the only thing is that you don't have to worry so much for your periods if it is slightly heavy or if it is irregular. Suppose it comes in 2 months, 3 months, so you don't worry so much. Okay, sometimes period is very less, few drops only, so mothers are so much worried what is happening, and they start abusing the child. What have you done? It may be pregnancy or like that. Please don't do that, because a child, a girl is not a girl now. She's growing older, so there is disturbance in her body as well as in her mind. So don't abuse the child that what you have done. If you want to ask something, you ask very, very politely, and most important is you explain all the things to your child, that what is right, what is wrong, and if wrong, then why it is wrong, what is the result of that wrong thing. If you will involve in sex, then what will happen, what is the result of that? You have to explain to your child. Don't abuse her. Okay, so now let me come to my topic. If there is irregularity in your periods, in a teenager girl's period, or if it is very scanty, if it is slightly heavy, if it is irregular, then just, if you're very much worried, you go and consult with a gynecologist once. But many a times I come to the people that they consulted so many gynecologists and still they are not satisfied. So don't do that, because this is a natural thing. Many a times that this happens to many girls. So you should be quiet. Consult one gynecologist, that is sufficient. And if she is saying don't worry, then don't worry. Definitely don't worry. There is no need of any treatment, unnecessary treatment. If it is not troublesome, then there is no hurry. Don't do any hurry. Okay? So let me tell you what other things can happen. If you are really worried and if you want some investigations, then definitely you can go for thyroid profile testing, because sometimes there are abnormality in thyroid profile and your periods may be irregular. You can go for some blood test and simple one ultrasound. This is enough. What I think, if mother is very much worried, then I usually prescribe some blood test which can be done in this situation, thyroid profile and one ultrasound, and that is sufficient. If there is not a major problem, if bleeding is not very heavy, if it is slightly more or less or irregular, then I advise only these things, and these are sufficient for the reassurance of the mother. Okay, so that's why I am discussing this topic, because mothers should understand that if a girl is growing and if she has got irregularities in her period, then she don't have to create any panic. Okay, you have to give psychological support to your child. She is growing older. Okay, now she is in her teenage, and this is the time when she needs very much support from her mother's side. So you should understand the situation of your child, that now there are changes in her body as well as in her mind. So you have to be with your girl child, with your child. Okay, so now if suppose periods are very heavy, and so definitely there are chances that she may develop anemia, that is deficiency of hemoglobin. So this is really a thing that you should be worried about. So for that, definitely you have to consult your gynecologist, and she will give some symptomatic treatment, and if necessary she will give some progesterone to lessen your period and to regularize your period. So it may happen that she will give you for this progesterone therapy for a few months. Like initially she'll give like medroxyprogesterone acetate or norethestron, that is 5 milligram thrice a day, and definitely your her bleeding will go down, and in 3 to 7 days period it will be more or less controlled, and she may continue this for 21 days, and then 1 week gap, and again then she'll start this treatment for 21 days. So she can continue this progesterone treatment for few cycles, 4 to 6 cycles. So you should go by a gynecologist if she is suggesting this hormonal treatment, because this may regularize your girl's menstrual cycle. Okay, and if period is very heavy, then definitely she may in need of blood transfusion and other things, IV injections, IV estrogen and all. So don't wait till that time. Definitely if period is too heavy, then you should consult your gynecologist. Okay, and if you like my this video, then kindly like and subscribe my channel. Thank you. Bye bye. And मैं फिर आगे दूसरी वीडियो लेकर आऊँगी. I'll bring another video for you. And if you think there is any problem in language, like if you want this in Hindi language as well, then you can write to me on this channel, and accordingly I'll definitely manage. If you're facing any difficulty in my language, like if you don't understand English properly, and if you want this in Hindi, then also you can give me suggestions, and definitely I'll come forward with other topics of female girls as well as female, and we'll discuss on that. If you want some query to be discussed on this channel, then please write me, and definitely I'll discuss it with you. Okay, so friends, this is enough for today, and I hope this is helpful for you, for those mothers who are very much worried. Okay, so please like and subscribe my channel so that I can continue this channel for your health tips, to give advices to you. Thank you friends. Bye bye.